Maine's Department of Health and Human Services. Commissioner Lambrew and I are delighted to be able to join everyone this afternoon to provide an update on where we stand with COVID-19 for today, Monday, December 7th, 2020. Right now, across the state, there are a total of 13,775 cases of COVID-19, an increase of 427 cases since yesterday. Of those, 12,097 are confirmed cases and 1,678 are probable. Sadly, there have been a total of 227 deaths, the same number of yesterday, and 781 individuals have been hospitalized. Right now in the state of Maine, 170 people are hospitalized with COVID-19, 52 of whom are in the intensive care unit and 17 of whom are on a ventilator. We'd like to take a moment to wish them all a safe and
This is Jeanne Lambrew, Commissioner. I think that Dr. Shah is frozen. I know that they're having internet problems at Maine CDC. Dr. Shah, are you back? No, Dr. Shah. So why don't I continue and he'll hopefully be able to catch up with me. We also know that as of today, we did open one new outbreak. Dr. Shah, are you there? I see him moving, but he's not quite moving, so we'll just keep going. So we did open one new outbreak today. We opened one new outbreak yesterday. We opened 9 new outbreaks on Saturday. I don't know if Dr. Shah, you'd like to continue to talk about outbreaks?
Sure, thanks, Commissioner. And for everyone's awareness, as Commissioner Lambrew, as I heard her mention, we are having some internet connectivity issues today over at our main office here in Augusta. So I'm tethering off of another device, so if things are a little choppy or I blank out for a moment, I'll try to get back on as soon as possible. With respect to outbreaks, as to where we are, as the Commissioner mentioned, we have opened a number of new outbreak investigations in recent days. Just this morning, we opened an investigation into the Flood Brothers Farm, where we are aware of 13 cases of COVID-19. Yesterday, an investigation into Lakeview Terrace, an assisted living facility in Lincoln, where we are aware also of 13 cases. And on Saturday, a significant number of new outbreak investigations. One at the Baker Company, where we're aware of 3 cases, at Dirigo Middle School, at the Fruit Street School, at Ranger Memorial School, at Nichols in Portland, at Noble High School, and at the Washburn Dowdy Shipbuilding Firm, and finally at York High School, where we have reopened an outbreak investigation. Right now, there are a total of 8 cases associated with York High School. Turning next to some updates on where we stand with respect to testing. Starting first with PCR tests. Our 7-day PCR test positivity rate right now stands at about 4.7%. And our 7-day PCR testing volume right now stands at about 649 PCR tests for every 100,000 people. As I mentioned last week, we're starting to see more stability in the data around antigen testing. Our antigen testing 7-day positivity rate stands at about 4.5%, and our antigen testing volume is about 161 antigen tests for every 100,000 people in Maine. Before we turn to questions, I'd like to provide an update on something we started discussing on Friday, which are some changes that Maine CDC is making to the way in which we investigate cases of COVID-19. On Friday, we talked a lot about the significant increases in cases, outbreaks, hospitalizations, and sadly in deaths that Maine has experienced in recent weeks. For example, with respect to the number of cases, the 7-day moving average of new daily cases in Maine now stands at 291. Just 1 week ago, it was 168. That's a 73% increase just in 1 week. Today, right now, there are 170 people in the hospital. 1 week ago, it was 139, a 22% increase in hospitalizations just in the last 7 days. A week ago, our positivity rate was about 3.95%. Today, it's 4.7%. Quite sadly, just in the past 7 days, 33 Maine people have died with COVID-19. For weeks now, Maine CDC has been anticipating and preparing for this increase. We have redeployed internal staff. We've brought on members of the National Guard. We've worked across the Department of Health and Human Services to bring on and identify additional staff to assist, and we have been hiring and hiring. We are not slowing down with any of those processes at all. But sadly, we were already experiencing a surge of cases, and last week, things accelerated even more, and we began experiencing a surge on top of a surge. This week, too, started off with a confirmation of concerns that we foreshadowed a few weeks ago. An increase of cases starting today with 427 cases today. Over the past few days, Maine CDC has identified two interrelated concerns. One is the rapidly growing number of lab reports that we must review every single day. And then related to that, our obligation to assign them for investigation, ensuring we can focus on the highest risk, most vulnerable individuals. Now, before I go into this a little bit more, I'd like to pause for a second to talk a little bit about the process that happens between when someone gets tested for COVID-19 and when a full case investigation gets launched. When a person goes to a lab, any lab, and gets tested for COVID-19, if that result is positive, it gets reported to Maine CDC, either electronically or by fax. Each and every one of those positive lab reports has to be reviewed by somebody. That somebody has to determine whether that is a new case of COVID-19 or whether it is an existing person, for example, who has already been logged in our system. So for example, some people get multiple rounds of COVID testing as part of treatment they're getting. We need to make sure that when we get a new lab result, we're not double counting cases. We also need to make sure that the lab results we get are not duplicates. Maine is what is called a dual reporting state. That means that Maine CDC often gets two versions of the same positive lab report, one of which might come from the laboratory, the other of which might come from the person's doctor. Every one of those lab reports that we get electronically or by fax has to go through a process to make sure it's not a duplicate or that it's not the same lab result on someone who's already tested positive. All of that requires a thorough review to ensure that when we have a case, it is a new case, not an existing case. Accuracy matters in this process because what's at stake is an accurate daily case count. In recent days, we've developed a gap. The number of new lab reports that has been coming into Maine CDC has exceeded our ability to do that review process on a daily basis. For example, on Friday alone, we received 650 such reports. Now, we foresaw that this increase was coming and we believed we could keep up with it. But the surge on top of the surge that we saw last week challenged that process. Now, let me be really clear here. This is not a backlog at the Maine CDC laboratory. And this number of cases that we still have to review does not affect things like our positivity rate or the number of people in the hospital. All the same, we faced this issue and we knew that we needed to make some changes. There was another companion concern that arose, which is what we do with those cases after we have confirmed them as new cases of COVID-19. As I mentioned on Friday, we spent time analyzing the set of choices that we had in front of us with a focus of preserving our ability to address the needs of the highest risk individuals in our state, as well as those they care for or who care for them. These discussions and decisions were extremely difficult and they were unpalatable, but they were also necessary in these times of an unprecedented surge. As I discussed on Friday, the sustained increase in numbers of new cases and numbers of new daily lab reports has outpaced Maine CDC's ability to continue the approach that has taken us where we are right now. As a result, we have had to make some changes to the way that Maine CDC operationalizes the way that we go about investigating cases. I'd like to walk through those now. Until now, every person who tested positive with COVID-19 received a case investigation from Maine CDC. But in light of the significant number of increasing new cases, Maine CDC is announcing the following changes to our case investigation protocol. We will continue to conduct case investigations within the following groups: those who are aged 18 and younger, those who are aged 65 and older, people identified on their lab report as being a healthcare worker or a first responder, people who are hospitalized, people who are identified on the lab report as being part of a demographic that has had a higher burden of disease in Maine, people who are identified as having a disability, or people who are known to be living in or working in congregate living settings, like certain healthcare facilities, nursing facilities, shelters for people experiencing homelessness, group homes, or correctional facilities, and finally, individuals known to be associated with schools or childcare facilities. Individuals in those groups will continue to receive a full case investigation. Individuals who fall outside of those groups may not receive a full case investigation. However, they will continue to receive notification as well as offers of assistance and support from Maine DHHS. Maine DHHS is creating a new service whereby individuals who do not fall into one of the categories I mentioned will continue to receive notification from the state of Maine of their positive lab result, as well as offers of assistance so that they may continue to go through the isolation process safely and without incident. That outreach will ensure that they know of their positive case status, they know the basics on what to do in order to isolate and stay safe, and they know how to access social supports. The changes that I've outlined here have been very challenging. The discussions were not easy. There were no easy choices in front of us. As of this morning, the number of laboratory results that are awaiting review to determine whether they are duplicates or whether they are already individuals who are in our system had grown sadly to over 4,000. We are making efforts as quickly as we can to bring that back under control. The changes that we are making to the case investigation process in the categories I've mentioned will similarly enable us to focus our available public health resources on caring for the most vulnerable residents in Maine, our elderly neighbors, those who are living in congregate living settings. It will also allow us to focus our available resources on those who care for them, like healthcare workers and first responders. The bottom line for everyone is that right now, for where we are in the COVID-19 pandemic, Maine CDC finds itself sort of in the position of a very busy, crowded emergency room. And just like in any emergency room, we have to take our available resources to make sure we are serving those who are in the highest need at their greatest moment of need. These choices are difficult, but let me end by talking about what this change means for you. First of all, this is a change that's internal to Maine CDC. It does not affect things like testing or PPE or clinical treatment or the care that you may receive if you were to go to your healthcare provider. It means that if you test positive for COVID-19, the very first thing I'm asking you to do before you hear from anybody from Maine CDC or before you may hear from your healthcare provider, the first thing I'm asking you to do is to promptly isolate, to separate from others so you don't have you lower your risk of spreading COVID-19 to others. The other thing I'm asking everyone to do is that if you test positive for COVID-19, before you hear from anybody, please think about the folks that you have come into close contact with, and please notify them as soon as you can. If you are in one of the higher risk categories that I mentioned, you will hear from Maine CDC, and we will develop a list of your close contacts and reach out to them. But before that process happens, please do so yourself. If you are not in one of those high risk categories, going forward, you will not hear from Maine CDC. And we are asking you to help us make sure that you can notify your close contacts as soon as possible so that they too can quarantine for 10 days. I'll close with this. These choices are incredibly difficult, but as Commissioner Lambrew and I have talked about, we are in a position where there are no easy options in front of us. We at the state will continue to do everything we can to continue the processes, to bring more people on, to hire more, and to continue staying on top of the virus as much as we can. But sadly, we're in a situation where, just like at the emergency room, some difficult decisions have to be made. The pledge that I've always tried to maintain is that whether there's good news or bad news, I want you to hear it from me first, with an explanation of why we're doing so and what this will enable us to do. In this situation, this is difficult news, but I want you to hear it from me and from me first, with the understanding that we do so in order to keep our focus on the most vulnerable Maine people and those who are helping them in the healthcare community and elsewhere. So with that, I'd like to turn things over to questions. And our first question for the afternoon goes to Patrick Whittle.
Thank you very much. So, I'm sorry, can you hear me okay? I'm getting a little bit of feedback. Am I coming through clear?
Yep, loud and clear, Patrick.
Okay, thank you for telling me that. So two things. I want to make sure I fully understand what the difference is between a case investigation and contact tracing, and if there is a difference. And if you could sort of explain that, that would be swell. And also, there's been some reporting that has characterized the state as being in a testing shortage or approaching one. I would like to know if that is accurate, and if so, what the plan is about that going forward.
Sorry, accidentally muted myself. Absolutely, Patrick. Let me start with the former question, and I'll ask Commissioner Lambrew to weigh in on the second. As to the former, when a case investigation and contact tracing are two sides of a coin. Case investigation asks questions fundamentally around where somebody may have gotten COVID-19 from. Contact tracing asks, who did they possibly give it to? Case investigation asks questions like, where may you have been such that you may have been exposed to COVID-19? Contact tracing says, who were you in contact with in the time leading up to when you had symptoms that you may have inadvertently exposed to COVID-19. So that's the fundamental difference between the two. Obviously, they work hand in hand with one another, but they are in concept different ideas. One looks at upstream, where'd you get it from? Contact tracing looks downstream, who may have you given it to?
So is it safe to say that if you're subject to one, you're subject to both?
Yes, that is safe to say, Patrick. However, just for extreme clarity, as a result of today's change, certain individuals who are not among the highest risk categories will no longer go through the case investigation process. And as a result of that, we will not elicit their close contacts, and thus we will be asking them to notify their own close contacts.
Right.
And to add one point to that, but we have added this third new category called case notification. So what we will do is we are committed to using our call center experts to reach out to those people who will not get a case investigator calling them to notify them that they are in isolation. What does that mean? How to get support and what to do if they need help. So we continue to try to ensure that we reach out to all people with COVID-19 in the state of Maine. And to your question about testing, we continue to have our state lab performing tests. We have supplies of testing materials from IDEX. We continue to have commercial labs in the state and outside of the state producing tests. What we are concerned about is the federal government announced earlier this year that the state of Maine would get 400,000 rapid antigen tests, also called Binax Now tests. That amount of tests was going to come to us through the end of December, and we plan for that. We have Walgreens throughout the state providing that test, plus we reserved about a fourth of that to go to the islands, for example, or EMS, or other sites that might be able to use these tests. However, only to date, we've only gotten about 168,000 of that 400,000 number. The amount that we've gotten each week has dropped by 70%, which is why the governor last week asked the coronavirus task force, asked the vice president, why is our supply diminishing? Because we plan for this 400,000 Binax Now test coming to the state of Maine. But in response, this morning, the federal government hosted a call with myself and a representative from the governor's office. We heard that this week we will get about 7 times the number of tests that we got last week. And there was a commitment to get us the full 400,000 tests, if not by the end of the month, by early January, which is progress. We're grateful for the governor asking the question, our delegation for helping us, as well as the federal government for telling us we can plan on what we were originally told. That still leaves the open question, what happens then? What happens after that 400,000 Binax Now rapid test supply is over? We continue to look for answers to that question. We think there may be something coming from the federal government. If not, we'll be working on that on our own. So we do continue to be concerned about the supply of rapid tests coming our way.
Before I turn to the next question, there's one other important piece, turning back for a moment on the case investigation front. As I mentioned, the choices that we've had to make were unpalatable. They are, however, choices that other states have confronted, and we were able to converse with them, discuss with them how they went about making similar changes. In particular, we consulted with New Hampshire, New Jersey, and Kentucky, among others, to learn how they navigated a similar change. A number of other states are in the same position as is Maine, but I just wanted to be, again, clear with everybody. This is a challenge that the entire country is facing, but we wanted to make sure we were discussing with everybody straight away, and everyone was hearing the news from us rather than from anyone else. I'm going to turn now to Ashley Blackford at WAGM.
Hi, Dr. Shah. Since March, the CDC website shows 16 hospitalizations total in Aroostook County. We've done sort of an informal survey and know of at least 8 right now. So I just wanted to check, is this number 16, is that up to date and accurate?
Sure, Ashley. We endeavor to keep the numbers on our website as up to date as we can, but it's often the case with such a high number of new hospitalizations coming in and happening every day that hospitals themselves may have information that is ahead of what Maine CDC has by a day or multiple days. By the time we receive word of the hospitalization and then our website gets updated, again, there may be a couple of days. And so it's entirely plausible, Ashley, that the information that you've got in real time from the hospitals our website just hasn't been updated to reflect it yet. I'm going to turn over to Allison Ross next.
Hi, Dr. Shah, thanks so much. So I have some questions too about vaccines. So what role, if any, will the National Guard play in distributing or administering a COVID-19 vaccine? And then would the goal be to have vaccines given to everyday community members by like pharmacists and their doctors or nurse? And then I just have one more follow-up question.
Okay, so with respect to the National Guard, late last week, we did receive word that the administration, the federal government, has extended the ability of men and women in the National Guard to continue participating in and assisting with the COVID-19 response, at least through the middle of March. It may be extended thereafter, but that's the initial extension. So Allison, as a result of that, we are looking at ways in which the National Guard may be utilized. We're working with them. They've been at the planning table ever since we started our vaccine planning efforts. No specific role for them as vaccinators has been developed yet. They have certainly been critical in helping us think through logistics, transport, things of that nature. But to your particular question as vaccinators, it's a possibility, but it hasn't been fully developed, nor has it been signed off on by the National Guard yet. And then your second question is, when we get into community vaccination, whom do we expect providing those vaccines? And the answer there, Allison, is everyone. Any healthcare provider who has received the requisite training, has the requisite skills, we're looking to work with them to ensure that they have the ability to vaccinate their patients. Perhaps that's pharmacists, perhaps that's other types of primary care providers, but we're also looking and working, for example, with EMS clinicians who are spread across Maine and are often pillars and trusted in their community as healthcare providers. We're looking to work with them as well as the fire stations and EMS stations that they work out of as potential sites for vaccine.
Okay, and then where do Maine's jails and prisons fall in line with vaccinations? They've kind of been a hotspot, and we know that it can spread pretty rapidly in there. So would they be considered in that first category of people vaccinated?
I don't think a final decision has been made there. We are in discussions with the Department of Corrections to try to get a sense of what their vaccination capacity is, because that's a critical piece of that. I don't think a final decision has been made there. We're looking right now, given that the US CDC's advisory committee just officially released their pronouncements and their recommendations just Friday in written form, we're studying those to see where their thinking is with respect to correctional facilities, and then matching that up with the supply that we'll be having. But the critical piece there is the throughput, the ability of folks to get vaccinated. That's what we've been working on the Department of Corrections with right now.
Great, thank you.
I'm going to turn things over to Amy Brown at WERU.
Thanks, Dr. Shah. I just want to make sure I understand you correctly about the changes. If a person is someone who tests positive and is not known to be in any of the categories you listed, they'll receive a phone call from someone connected through DHHS, possibly not CDC, who lets them know they're positive and possibly points them to some resources. And then they'll notify their own possible contacts. But if a person is known to be in one of those categories, they'll receive a call from a CDC contact tracer or case investigator, and then have some more assistance with the contact tracing. Is that all right so far?
That is all correct, Amy.
Okay, great, thanks. And then if they are in one of those categories and the state was not aware of it, they just tip off the person who calls them to let them know that they're a healthcare worker, for instance, but the state didn't have them listed as such.
Right. So one example that could happen is that we don't initially know that they're a healthcare worker. And so they get a call from what Commissioner Lambrew noted as a case notifier. And in that conversation, the person who's just tested positive says, hey, I work at a hospital. What do I need to do? We're going to make sure we have a feedback loop. So that person, now being known to be in a higher risk category, gets fed back over to Maine CDC and will receive the full case investigation process that you noted, Amy.
Great.
That is a good reminder that when people are, for example, scheduling a test online, please fill out all those different fields. Sometimes it feels like it's unnecessary information. It's very important information for us to make sure that we are appropriately assigning cases. And the same goes for our healthcare providers. I know it takes extra time to fill out all those fields on these forms. These are data that we ask for at the Maine CDC and DHHS, and we really do urge people and providers to fill out their forms completely. That will help us provide the best possible service to people in Maine.
Great, thank you. And then about outbreaks, I can't write fast enough. There's so many outbreaks now to keep track with all the outbreaks that you're listing every day. Wondering if those could be listed somewhere, partly because my question is numbers have just been going up exponentially in Penobscot County, more so than in the surrounding counties. And I'm wondering how much of that might be connected with outbreaks versus community spread.
Sure. We can see we'll get you the full list of outbreaks that I went through, Amy. I recognize I moved through those relatively quickly. In terms of the proportion of community transmission versus outbreak-driven transmission, I haven't done a specific analysis as to Penobscot County. What I can say is that statewide, on any given day, the fraction of cases that is accounted for by folks in outbreaks as opposed by not in outbreaks, the majority are accounted for by individuals not associated with an outbreak on the day we get their case. A smaller and smaller fraction each day are outbreak associated. More evidence of widespread community transmission.
Thank you.
I'm going to turn it over to Steve Missler next.
Thanks for taking the question. I know you get a version of this question probably, or you have got a version of this question over the last few weeks, but I guess I'm just wondering, in light of these case increases and hospitalizations and everything else, and the messaging that you guys have attempted to get for voluntary compliance on these public health guidelines, I'm guess what's left in the toolbox to get these numbers under control? And is it rhetorical? Is there something else that you guys can do? Because even in my observation, there are well-meaning people that are engaging in some risky behavior. Either it's just pandemic fatigue, whatever, and that's setting aside the folks that are openly defying these some of these public health measures. It's an open-ended question. I'm just wondering where your mind is as you see these numbers. And they're from your perspective, I imagine they're not. It's not a welcome sight.
So maybe I'll start, Dr. Shah, and say, we think of all of the above. Number one is policy. Are there other policy levers that we should be pulling to try to limit the spread of COVID-19? As we've said, we always are looking at what's working in other places, what else could we do, what are the new policies that would make a difference. We did announce a few policies last week. We always strive to balance out any new change with the economic, the mental health, the behavioral health implications to strike that balance, but there are additional policies that are under consideration. Second is ensuring that the ones that we have on the books are being enforced. We've been working on increasing our support for example, retail. So when people come to the door of a large retail establishment and are not wearing a mask, we give people at that store the ability to say they can't enter. And giving them the tools to do so. So enforcement is our number two set of activities to ensure that we're keeping people safe within the rules that we've already put out there. But the third is going back to our own actions, our own behaviors, because much of the spread we've seen in the past month is in our homes, in family gatherings, in circumstances that are beyond the scope and the reach of state government. So we continue to try to work all angles to figure out how do we communicate the risks and the benefits of these public health measures, because it really is, at the end of the day, up to each of us to protect ourselves and protect our families.
I don't have much to add to that, Steve. I completely concur.
Well, I guess I would just follow up, Commissioner, with your that there are other policy considerations that you guys are thinking about. Can you give a sense of what those might be? We can certainly look around the country for other examples, but what we're seeing in other parts of the country where the thing has gotten out of control is a return to regionalized or in some cases widespread stay-at-home orders. I mean, is that, I know that the governor has said that she doesn't really want to go to that place again, and politically it might be very difficult. Is that on the table? I guess the question.
Sure. I don't think any governor, any state, even the federal officials want to go to a blanket stay-at-home order, given what we learned about the consequences last spring, when that was the only tool that seemed available with the unknowns about COVID-19 out there. Our approach is to look to be targeted where possible. How do we figure out what might have the greatest impact? To figure out equitable issues. How are we doing our policies so we're not disproportionately harming certain people or certain businesses or certain parts of the state? We also look hard to see, is it enforceable? There are some policies we've seen in different places that would require all sorts of new people to try to enforce them, which may not be effective. So when we're looking at all the different policies, and certainly there are many across the states, we do try to filter them by their efficacy, by how targeted they are, by their enforceability. But we don't have any new ones to announce at this time. But I can assure you that Governor Mills is always looking at every option on the table to balance out public health, which is our North Star, with keeping Maine's economy going.
I'm going to turn over to Ann Burlient at the Ellsworth American next.
Thank you, Dr. Shah and Dr. Lambrew. I have a couple of questions related to nursing homes, specifically the Island Nursing Home in Deer Isle. My first question is, and they're open-ended, after outbreaks at nursing homes, including the ongoing situation at the Island Nursing Home, many people are looking for someone to blame for allowing these fragile populations to be exposed to the virus. In your opinion, is it possible for a nursing home to keep the virus out if the community around it is not taking its own serious precautions with staff and workers coming in and out? How do you keep that bubble is kind of the question.
Sure. And what we've seen across the country, as well as within Maine, is that one of the best ways to keep nursing home residents safe is to keep communities safe, to keep levels and rates of community transmission of COVID-19 as low as possible. In many instances, COVID-19 is introduced into nursing facilities by employees. And the best way to reduce the likelihood that any particular employee is positive for COVID-19 is to keep the community safe. Now, every nursing home is doing different things in that regard. We've had a number of very productive conversations with Island Nursing Home. They're facing extremely difficult challenges, but they have been also doing everything they can to keep their residents safe, as well as to make sure that when situations are unfolding, they've been communicating with our team up here to make sure we can help them.
Thank you. Do you have an update on the case numbers at the Island Nursing Home?
As of yesterday, there were a total of 90 cases of COVID-19 at Island Nursing Home, 59 cases among residents, and 31 cases among staff members. That was as of yesterday. They are slated to do another round of universal testing this upcoming Wednesday.
And one final question is, are those residents who are symptomatic, are they being treated in the nursing home, or at what point do they become hospitalized?
That's ultimately a question for their healthcare provider, as well as the medical director and medical administration of Island Nursing Home. In the medical community, there are different criteria, but it's ultimately a case-by-case determination of when someone needs to go off to the hospital for more treatment.
Okay, thank you so much.
You bet, Ann. I'm going to turn things over to Dustin at New England Cable News.
Hi, Dr. Shah. First question's for you. Just overall, how do we stack up nationally? Obviously, there's cause for worry here, but where is COVID-19 more or less concerning than in Maine right now?
More concerning, pretty much everywhere. Less concerning, Prince Edward Island, which is obviously not in our country. But I mean, even though the discussions we've been having lately are of concern to us, we've talked about unpalatable choices and challenges that we've been facing. I'm not one, as folks know, that likes to talk about where we stack up because it's bad everywhere. But Dustin, since you asked, it's bad everywhere, but there are some places where it's worse than it is in Maine. For example, the national positivity rate right now across the country is upwards of 10%. It's less than half that in Maine. The number of new average daily cases across the country is in the many hundreds per million per day. In Maine, it's about 127. So we are facing significant challenges here in Maine. There are places in the country that are facing even more significant challenges.
Next, does the amount of schools on your outbreak list that you went through earlier worry you particularly at all? And how's that shaping your thinking right now?
Well, there's a couple, I'm glad you asked that, Dustin. There's schools remain a top focus for us. For example, earlier when we were talking about the groups that we are going to continue our intensive case investigation on, those 18 and under remain on that list because we remain concerned about schools. But there's a couple of things to note with respect to schools. We open a lot of outbreak investigations at schools, but those are often a function of community transmission. For example, when we open an outbreak investigation in a school, we sometimes find that the likely location, the possible location for transmission may have been outside of the school in some instances. So the other thing to keep in mind is that although we do open a number of investigations with 3, 4, 7, 8 cases, because of the impressive work that educators, staff members, parents, and students themselves have done within schools, the rate of transmission of COVID-19 in schools, thankfully is not something that has gotten out of control. Do we find outbreaks? Yes. Are there cases in schools? Yes. Is there possibly some degree of transmission happening? Most definitely. But are they foci for significant community outbreaks? Thus far, across the state, we have not seen that. My plea for everybody is that one of the things that you can do to help keep kids in school, in classroom education, something we know is so vital, is to take steps yourself to stay safe. Kind of going back to Steve Missler's question, thinking about motivations. One of the motivations I talk to my folks in my neighborhood about is, you know what, if you want to keep all the kids in school, let's all do what we can to wear face coverings, stay physically distant, because that's a way we can keep kids in school.
Lastly, this is maybe a question for Commissioner Lambrew. Why close businesses at 9 instead of something like scaling back indoor dining, since we've talked so much about indoors versus outdoors?
So we did, and we're not the first state to do this. There are a number of states that have limited business hours as a means of limiting engagement. The shorter the hours, the fewer people can be in a indoor gathering setting, and that will help us prevent the spread of COVID-19. It's as simple as that. I think Dr. Shah can talk a little bit more about kind of the type of hours in a second, but I think we are always trying to be targeted, trying to identify ways that we can scale back engagement and interaction in ways that can continue to keep some of our small businesses and other businesses open. I would note that Governor Mills has repeatedly said that unlike previous periods of time, we don't have federal support in the same way that we do. So every time we do add a restriction, we are making, potentially causing more harm to businesses, to Maine families that we have no federal support to react to. So we do take our limit seriously. The 9 p.m. closure is a restriction the governor didn't want to lift at this time. But I think, Dr. Shah, you could talk a little bit more about 9 p.m. versus other types of restrictions.
Yeah, I mean, Dustin, there's two questions, I think, in your question. One is the concept of an hours closing, and then the secondary question of what time that should be. The concept behind the hours is, I think, something that, frankly, just from an experiential perspective, we've all seen, which is the later the hour, the less likelihood there is to be strict adherence to best public health guidelines. That's something we've all experienced in our own lives. And that's just something that we thought is important to recognize, that as the evening goes on and on and on, the likelihood that folks may not have face coverings on, especially if they're drinking more or what have you, it goes up and up and up. And those being the situations that we were particularly worried about transmission. Transmission that starts at a restaurant can then go back to the home and others can get infected. And then you get back into that loop of outbreaks causing community transmission, causing outbreaks, causing community transmission. The related question, Dustin, is what hour? 9 o'clock is where Maine landed. Massachusetts landed on 9:30. There's trade-offs between all of those things, certainly. You trade off a little bit more in dining room business for a little bit less protection against the virus. That's just a trade-off. What I think is really important, though, is that although the dining room may be closed at 9 p.m., takeout's not. The restaurant can still activate. They can still operate for things like curbside and takeout, and that's where what we've been encouraging as well.
Can everybody please check their mute?
Yeah, that'd be helpful. Thank you. And while we do that, I'm going to turn things over to Charlie at the BDN.
Yep. Hi, Dr. Shah. Thanks. And also Commissioner Lambrew. My first, one quick question is just, at last count, you had said that the Maine CDC has something like 142 current employees doing contact tracing and case investigation. Is that still the number?
That's about right. So the number is changing because, Charlie, we're bringing on this new team of case notifiers that Commissioner Lambrew noted. So that will that process is being stood up as we speak. So that will add to the number as well.
Okay. So I have two other questions about the change. One is, so for the people who are not in those priority groups, how will they be notified to reach out to their contacts themselves? Will that be through the call center people?
That is correct, Charlie. And sorry, to go back to your earlier question as well, we're also training folks as well. We've got a training class, one that started last week. There's another one that started this week. So we're continuing to train more and more case investigators. So those numbers we hope will continue to go up. But yes, as to the point that you made, that individual who may not be amongst the highest priority, highest risk groups, they will be asked to notify their close contacts via the case notifiers.
I mean, what are your concerns about how will this, potentially hinder Maine's continuing response to the coronavirus? I mean, I could picture one difficulty might just be that it's less likely those people will go through with contacting their contacts, but are there any concerns that you have?
That's a risk, Charlie. It's a risk that we had to balance against making sure that we could really focus on individuals who are at the highest medical risk. For example, those who are elderly, and making sure they've got all the medical and social supports they need, as well as individuals who are likely to potentially transmit the virus to large numbers of people. People who work in congregate settings, people who work in shelters for people experiencing homelessness, people who work in healthcare. So that was a balance, but you're right. It's possible that individuals may not notify all of their close contacts. That remains a risk.
And just, are there any other, potential areas where things may fall short that you can anticipate?
It's difficult to speculate, Charlie, but there's another one that, again, for the interest of being completely straight and transparent with folks, this is something that Commissioner Lambrew referenced a moment ago. We know, for example, if someone is a healthcare worker, because when they go to get tested, testing locations are required to ask a series of questions, one of which is, are you a healthcare worker? If someone doesn't answer that question, or the question is not asked, we at the Maine CDC may not know the answer to that. So there are some individuals who may in fact be in our priority category who, because the question may not be asked or it may not be answered, we may not find out about it. That is all the more reason to please ask the question and please answer the question. Are you a healthcare worker? Are you a member of a demographic that has been disproportionately burdened by the virus? Do you work in a congregate living settings? Those will be the flags that we look for to ensure that somebody gets a full investigation and all their contacts are notified.
Okay, thank you.
I am going to turn to Rosalind Flaherty at News Center next.
Hi, Dr. Shah. Going back to the school outbreaks, have you found that any of the outbreaks are linked to Thanksgiving gatherings at all?
Any of the school outbreaks linked to Thanksgiving, Rosalind, is that your question?
Yes.
I'm not aware. I can check with our team of epidemiologists to see if they've got any evidence directly linking a school outbreak to Thanksgiving, but I have not been briefed on that connection. We can check, but I'm not aware of one.
Just one point on schools, just to add, you know, we do, and we're going to try to do this on a weekly basis when the Department of Education issues the health advisory for the purposes of in-person learning. We do have in there a paragraph that talks about the new case rate in schools compared to the state. And so last Friday, it reported that over the past 30 days, the new case rate associated with schools was 15.5 compared to the statewide rate of 41.4. That, again, doesn't mean that there's not some transmission potentially happening in school. It does not mean that schools are immune from community spread. But I do think when people ask the question, are children and staff and teachers safe in schools? I don't think we have any evidence to say that they're more unsafe in schools than in other settings. And in fact, some research suggests the opposite.
Okay, thank you. Another question. What is the age range for hospitalizations and new positive cases?
We can check on that. I'll see if we can get one of our epidemiologists to pull that but you're asking about the current individuals who are currently hospitalized, what their age range is?
Yes. Yep. And the new positive cases as well.
We can pull that information. The last time I took a look at the hospitalization ages, what struck me was how broad it was. It was individuals who were on the younger side all the way to individuals on the older side. It was quite a broad range, but we'll see if we can pull that latest information and get that over to you.
Okay. And then one last question. I believe it was on Sunday, an entire shift at one of the Portland Fire Department stations called out sick after someone tested positive. They did this out of an abundance of caution. Should people be doing that? If someone at someone's work tests positive, should people be calling out for an abundance of caution?
It really does depend on the different types of workplaces and the nature of the potential interactions they may have had. There's, Rosalind, not a one-size-fits-all rule. It really does depend on how much interaction the person who is ill may have had with other coworkers in the time window between when that person tested positive and when they were starting to feel symptomatic. So there's not a one-size-fits-all rule. It's very, very highly case dependent. We can talk about what we do at the state of Maine and at Maine DHHS, which is to apply the approach I just noted, which is if someone tests positive and in the time period at which they could have been passing the virus, they were in the office and were potentially exposing a large number of people, we make the call to do that out of an abundance of caution, but it's highly fact specific.
Thank you.
I'm going to turn next over to Evan at the Maine Beacon.
Hi, Dr. Shah. Thank you. So you said at the briefing Friday that it's likely Maine's virus numbers will get worse. And I know that we've touched on this in previous briefings, but I was wondering if you could provide an update on whether it looks like from the publicly available cell phone data that Maine or state put enough in, for Thanksgiving to have a chance to slow the spread, or if the state travel around Thanksgiving is part of the reason that you think cases might continue to rise.
So Evan, we can talk a bit about that. We have received some data from Maine DOT about this, but to be very clear here, I have not seen or reviewed any recent cell phone data. I say this every time, but I have to say it every time. I want to be clear. Cell phone tracking data is not collected by the state of Maine or by Maine CDC. It is collected by cell phone companies and is put on various publicly accessible websites. We do not have a mechanism or a way to track cell phone movements. That being said, I have not looked at those data in connection with Thanksgiving. We have taken a look at data around just generally what traffic was like on the roadways, for example, and there were reductions. Commissioner Lambrew and I have discussed those data. And generally speaking, there were reductions in things like use of the tollway, traffic at the jet port, things like that. So that's an encouraging sign. Now, all that being said, Evan, the question is whether those reductions in travel were sufficient to result in reductions in cases. And again, going by the number of positive lab results that we receive every day, as well as just today, the new high mark in the number of cases, we fear that there will continue to be an increase in the number of new cases. Is that directly related to Thanksgiving or perhaps other epidemiological factors that may take us some time to sort out?
Great. And my second question is, I'm wondering for someone who has been diagnosed with COVID-19 but isn't in the hospital because they have mild symptoms or maybe no symptoms at all. Is there anything in particular that people in that situation can be doing to try and mitigate the effects of COVID-19, other than obviously isolating from the people?
Yeah, so you're referring to themselves. What can they do to help get themselves on a path to a speedy recovery?
Yes.
Yeah, it's one of those things that thankfully for many people, COVID-19 is a mild illness and does not require hospitalization. That's a good thing. Sadly, for many individuals who are elderly or have chronic medical conditions, it's a very severe illness. And so the bottom line here, Evan, is that many of the things that your grandma told you to do to stay healthy when you're not feeling well are helpful with COVID-19. Resting, make sure you've got plenty of fluids on board so you don't run the risk of dehydration. Things of that nature are good for any type of viral illness. However, if you are somebody who has chronic medical conditions, or if you live with somebody who has chronic medical conditions, that's a situation where you need to be in touch with your healthcare provider. You may be someone who's feeling well on day 1, 2, and 3, but sadly could experience a significant nosedive on day 4. So if you've got chronic medical conditions like asthma or emphysema or a number of other conditions that are on the CDC's website, that's a situation where you want to make sure you're communicating with your healthcare provider, because one of the unfortunate findings of COVID-19 is that folks can get really sick really fast. I've spoken with a colleague of mine in another state who experienced COVID many months ago. And what this colleague reported was that they were doing great on days 1, 2, 3, and 4, but on day 5, they were almost at the point they needed to go to the hospital. And that all happened within a 12-hour period. So if you've got those chronic medical conditions, or you live with or care for someone who does, don't take a chance. Get in touch with your healthcare provider.
Thank you.
I'm going to turn over to Taylor at WGME.
Yes, hello. Thanks for taking some questions. I have 2 today. So the first one deals with the current availability of tests. We heard earlier today you guys talking about how the federal funding is currently still in question and you guys are figuring out what the next steps might be. Can you kind of talk about what would happen here on the state level if we were to run out of federal funding, and what concerns you guys personally have about the lack of security from the federal side?
So there's 2 parts of what we get from the federal government in terms of testing. One is direct provision of tests like the Binax Now, like the ID Now, like swabs and viral transport media, we get direct supplies from the federal government. And we've had questions about the ongoing support that we're getting from the federal government on a periodic basis, including what we discussed earlier. We also get resources in terms of, coronavirus relief funds or an epidemiology and laboratory capacity grant that support our own direct purchase of many of these different types of testing supplies, as well as supporting the organizations like the Swab and Sends that provide it. We are concerned, as Governor Mills has said, and we talked to the congressional delegation about on Friday, with the uncertainty about what comes next. The funding from the spring is oftentimes almost about to expire. One of the major sources of funding does expire on December 31st, and at this moment in time is neither going to be extended nor replaced. So we continue to worry about, can we continue our swab and send sites into the new year without federal support? Can we continue our partnership with Walgreens supporting these rapid antigen tests for people with symptoms without federal support? These are open questions. We continue to work on a daily basis to both figure out what Congress may do, but also to figure out contingency plans, because the governor on down to Dr. Shah, myself, our teams, we're committed to continuing testing in Maine. We'll try to figure this out. We will figure it out better, though, if we have more certainty from the federal government.
Perfect. Thank you. And one last question. Speaking of changes that you talked about today, Dr. Shah, regarding the notification system, and if somebody doesn't have the necessary factors that they would have to have the CDC notify other people. I'm curious if this opens up either an individual or the state to any sort of legal actions or problems, as addressed earlier. If somebody were to test positive, they aren't among the high risk category, and they choose not to tell anyone, and somehow it causes some sort of spread or outbreak, is this a concern that it could end up somehow backfiring besides just causing more cases?
Taylor, it's an interesting question. It's an interesting hypothesis, but I don't think we can provide any legal analysis or legal insight into potential liabilities there. That would be a question for somebody and their individual attorney.
Okay, thank you.
I'm gonna turn it over to Morgan at WABI.
Hi, Dr. Shah, Commissioner Lambrew. My first question is about Winterberry Heights in Bangor. If you can provide an update on the numbers there.
Certainly, I will pull those up. While I am pulling those up, if you could turn to your second question, though.
Sure. My second question, and I apologize if this has been asked recently, but I was wondering about those alternative care sites that were established back in April, if those are still a possibility to use, or if things have changed so that they would not have to be used.
So
Sure.
Sorry, do you want to go ahead, Dr. Shah?
I was just going to provide the answer on Winterberry Heights just really quickly. The current number of cases there is 24, Morgan.
And on alternative care sites, we had plans in the spring when cases were surging. We are in the process of reviewing and re-upping those plans, but we also recognize that all of our healthcare system people, providers on down, prefer to have people who need hospital care in hospitals. So I think what we're working on is looking at whether or not there's additional hospital bed capacity, additional hospital staffing capacity, a regional set of plans, other options short of standing up the alternative care sites. So we are revisiting the trigger for what will it take before we need to establish those alternative care sites in arenas or gyms or other non-hospital settings, because that's a better way to provide patient care. Now, we will have those plans ready. That's our job. We need to be prepared for all eventualities, but we are hoping through a good round of review in the coming days to identify alternatives in the healthcare systems before we have to turn to alternative care sites outside of it.
Thank you.
And the last question for the afternoon goes to Joe Lawler.
Yes, hi, thanks. Taking Patrick Whittle's spot for the last question for today. So just a couple of quick hits. Commissioner Lambrew, I just wanted to, you had mentioned that there was a call with a federal official, and then they promised that you would get the remaining that you need of the 400,000. Was that Alex Azar or somebody else? Can you say who that was?
It was one of the admirals who works for Secretary Azar, who is in charge of Binex Now distribution. And it was not Admiral Gawar who is in charge of it. He was on travel, is my understanding.
Okay. And Dr. Shah, so if you include all the categories of people who will still have contact tracing occur, do we know like what percentage of cases that typically has been?
Yep, Joe, we've taken a look at that, and it will be approximately, it varies, of course, day by day, but on any given day, it will continue to be anywhere from 40 to 60% of daily cases will still fall within our high risk or categories of high concern.
Okay, and I know that you already discussed to some extent how this will curtail the ability to contact trace. Has there been any research or any experience from other states that when this falls off, that it leads to more spread, or are people generally pretty good about notifying on their own their close contacts? Can you discuss that a little bit?
Yeah, Joe, I have asked that question to specifically my counterparts in New Jersey as well as in Kentucky about what the experience they've had is. As you can imagine, Joe, it's difficult to quantify, but the experience, at least that my counterpart, Dr. Bresnitz in New Jersey indicated, was that they have had folks call up others that they knew that they had lunch with and notify folks. Alaska is taking a similar approach. And believe it or not, my counterpart there, Dr. Zink, indicated that what started off as kind of a tongue-in-cheek approach has actually taken ground in Alaska, which is to let folks know on Facebook. And so I've seen different approaches in talking with my counterparts in different states. I'm not advocating any of those in particular. We're advocating that you let people know if you've been in contact with somebody, and you should do so as quickly as possible. You need not wait until you get a call from Maine DHHS or Maine CDC, no matter what category you're in. The second you get that positive lab result, honestly, number one thing should be, can I isolate safely at home? If so, let me go do that. Number two, who have I been in contact with in the 2 days leading up to when I started feeling sick? Who did I have lunch with? Who did I talk to for 20 or 30 minutes outside of the house? You should immediately start making that list and letting folks know. That, to me, right now, for where we are in the pandemic, is one of the most responsible things that everyone can do.
I'll just add that one of the reasons, one of the reasons why we really do want to make sure we're reaching out to people is it's not that easy to be in isolation. We have supports for people. So if people really struggle with being able to get access to groceries or to otherwise isolate, we do here at the department have a COVID social support system that you can find online or get through 211. So we do want to make sure people know that they're not alone.
Okay, my last question is, Dr. Shah, if you could just, I know you said that you're training more people. If there's a way for case investigation, if there's a way you can put a number to that, if you anticipate hiring another 24 or whatever the number may be. And is there a target number? I mean, let's say, cases stabilize or even go down a little bit in, the next few weeks, which I know is not how we've been trending, but if it gets lucky, if we get lucky and it does, if we're down to, say, if there's a target, if we're at, say, an average of 200, does that mean you can resume full contact tracing, or do you think this will be how we do it for going forward?
So, Joe, let me first talk about the numbers. We had a training class that started last week where we trained 13 people. There's a new one that started today that has, I think, 12. And then the next several weeks of classes, with some recognition of the Christmas holiday, the next several weeks of classes are booked up as well. So we're going to continue to bring folks on as aggressively as we can, whether that is redeployed staff, newly hired staff, or, for example, our colleagues from the National Guard. We're going to keep filling out our training classes as much as we can. But
Yeah,
Joe,
and just to put
you made a good.
To put a finer point on it, we do anticipate 30 case investigators coming online in the coming weeks and 50 contact tracers. Thank you.
Yep. And Joe, you raise a point that it's a possibility. We would like to be able to turn the ratchet back down and move back to what we were doing in terms of providing a case investigation onto everybody. If we can simultaneously staff up even further, but more importantly, get more of a lid on the number of daily cases, that will allow us to move the ratchet in the other direction. We have the flexibility and the desire to do that. To sort of give you a sense of the numbers, Joe, just on Friday alone, we received over 600 positive lab results. And each and every one of those has to be reviewed and then potentially assigned out. So that, if we can get those numbers of new daily positive lab results back down to what they were like even 10 or 12 days ago, that would give us hope of moving back down. Whether that happens, it's up to all of us. So that's where we're at. That was Joe's question was the last one for the afternoon. So before we adjourn, I'd again just like to recap where we are. On top of a surge that had already been happening for the past 9 weeks, the past 7 or 8 days has seen a surge upon that surge, which prompted us to have to make some challenging decisions around how we review lab results, but more importantly, how we assign them out for investigation. Sadly, some individuals will not be going through that assignment of investigation process, but they will receive notification and immediate guidance on isolating and notifying their close contacts. We're committed to working our way through this as quickly as we can. The number right now stands at over 4,000, but we are working as aggressively as we can to move our way through it in the hope that we can resume normal operations. But that also depends on lowering the number of new daily reports that we receive. That's where we need your help. In order to move back to the way things were, we need your assistance. For right now, however, we pledge to ensure that the available public health resources will be focused on the highest risk individuals in the state, the most medically vulnerable, as well as those who provide care for them. There may be more changes forthcoming depending on the contours of the outbreak. As we have always pledged to do, we will let you know about those changes, and we will be straight with you about why we are making them and when we are making them. This is a difficult time, but we're asking for your assistance in helping us keep case numbers down across the state. So with that, I thank you for your time this afternoon. Commissioner Lambrew and I appreciate everyone spending some time to hear the latest about where we are directly from us. So with that, everyone, please have a good afternoon. As always, please be kind and take care of one another. We'll talk again on Wednesday.